fighting for our lives. Too little is being done too late.
There is an epidemic loose in the land. This memorial march is in honor of the past and future victims of AIDS, a so far incurable disease which kills its victims in stages.
I'm tired of losing people that I love and I care about.
The doctors believe that Bill Burke and these other men have it.
Every day you hear about more people?
Yeah, a friend of mine's going for biopsies today. Another friend of mine died 2 weeks ago. And every week, somebody else comes down with it, or somebody I know goes into the hospital who had been doing well. And it's heartbreaking. It's heartbreaking.
Heartbreaking and terrifying. Bill and these other men seem to be doing pretty well, but all of them know that 80% of all AIDS victims are dead within just 2 years. This is easily the worst epidemic since polio. The story of the birth and malignant spread of the killer disease may seem like a scenario from some horror movie, but this is real life.
Before I got capuchins, I thought I was a pretty good-looking guy, average but happy, and now I actually see myself fading away.
27-year-old Ken Ramser's case is unfortunately typical. Diagnosed just last summer, AIDS has already stripped his body of its ability to fight off other diseases and infections. Left unprotected, he's contracted Kaposi sarcoma, up to now a rare form of cancer.
Everything that I used to be able to do by myself, I now need lots of help with. And it's just scary. It's scary the way I'm not what I was.
And Ken is not the only one who is scared, but let's trace this killer disease back to its beginnings.
Free AIDS literature. Please learn about the symptoms.
In 1979, this is where the first cases came to light, in New York's Greenwich Village and within male homosexual communities in San Francisco and Los Angeles.
I was going out and meeting people and trying to find a lover and making love to people who interested me. I didn't know that, that there were things out there so secretly hidden that it was going to destroy my life.
Because it was first thought limited to this one group, it was known then as the gay cancer, and later the gay plague. However, those derogatory labels soon became obsolete.
I think it's naive to believe that the AIDS epidemic is going to remain confined to one small segment of the population. I think this is a problem for the entire American public.
When the disease was identified in mainlining drug users, the researchers were fairly convinced that it was like hepatitis, either sexually transmitted or bloodborne. But then in the fall of 1981, the mystery became even more ominous when the disease was also diagnosed in otherwise healthy immigrants from Haiti, men who were neither homosexual nor drug users. Then it spread to the women who were the sexual partners of those at risk.
If research funds are not brought to bear on this problem quickly, the problem is going to spread throughout the entire country and be a major health problem for us.
Like ink spreading on a blotter, AIDS continues to claim different types of victims. As an example, 8 infants born of high-risk parents seem to have contracted the disease. 4 have died. And just last summer, AIDS began turning up in hemophiliacs and other people who had received transfusions of blood. Some estimate there will be 20,000 AIDS cases reported by the end of next year. And so the evil genie is out of the bottle. With reported cases doubling every 6 months, AIDS has now been identified in over 35 states and 16 foreign countries. Of course, the counterattack has also begun. Scores of medical researchers and scientists are studying the problem. The epidemic has also received a great deal of recent attention in the news media. But one charge we hear really raises a question for all of us. Whether our prevailing social and political attitudes, put more bluntly, whether our negative attitudes about homosexuals allowed this killer epidemic a bizarre and deadly head start.
We're into this 2 years, and you are finally doing a story. Time and Newsweek are finally doing a story. There are 1,000, 1,600 cases. There are 800 dead people. How many does it take before somebody pays attention to it?
Larry Kramer, a co-founder of the Gay Men's Health Crisis, is especially critical of the newspaper of record, the New York Times.
The New York Times is being socially irresponsible by not relaying to 1 million members of its community what is affecting them.
Although New York has about half the reported cases in the nation, with about 250 dead so far, Kramer points out that in its coverage, the Times has never put the AIDS story on its front page. Contrast that with the front page prominence given a recent herpes outbreak that killed 30 dancing horses in Austria. The management of the New York Times, on the other hand, told us they feel they have adequately covered the story. In any case, now that AIDS poses a threat to the nation's blood supply, society and the media are finally paying attention.
Public officials are very influenced by public opinion, and public opinion is very much influenced by what the media does.
Henry Waxman has also been critical of the government's handling of the epidemic. He should know. He's chairman of the House Subcommittee on Health and the Environment.
We saw when Legionnaire's disease came up into the public awareness that there was immediate clamor for action. Had this disease afflicted children or members of the Chamber of Commerce, I'm sure the Reagan administration would have been breaking down all doors in order to push the government on all fronts to deal with it.
Has it been bigotry, bureaucracy, or budget cuts that have slowed the response to this terrible problem?
I think all three of those factors have meant that the government did not respond as we should have to this public health crisis. CDC first identified the disorder in June of 1981. According to your testimony, the first NIH grants were made 15 months later, and then for only $165,000.
Bothered by the apparently slow initial response to the AIDS epidemic, both Waxman of California and Senator Moynihan of New York have introduced legislation requesting $40 million a year for public health emergencies like AIDS. But Dr. Edward Brandt, the Assistant Secretary of Health, is opposed.
I oppose those measures because they're not needed.
And Dr. Brandt is the Reagan administration official to whom all public health agencies report.
It's given the fact that the disease is so complex and the ramifications so awful, the mortality rate so high, that critics say the federal government should have done more, sooner, more money, more people, more research. Isn't this the prototypical case where emergency funding and emergency measures should have been taken by the federal government?
The issue is, what would you have done different?
What might have been done differently? Example. With more federal money, researchers and scientists at the Centers for Disease Control, the CDC, might have been able to keep a closer watch on the spread of this killer disease.
The gay community has been trying for 9 months to get the CDC to reinstitute active, serious, in-depth surveillance, interviewing the victims to see who they had slept with, what they had done, figuring out the patterns. No one is doing that.
Example. Case reporting to public health officials is required for all of the following diseases: gonorrhea, hepatitis, German measles, and mumps. Case reporting is not required of AIDS.
Wouldn't it be logical then to have mandatory case reporting so your experts here in Washington or at the CDC in Atlanta will know exactly where the disease is going and presumably can use that as one factor in the evidence suggesting where it came from?
At the present time, with the heightened awareness in the professional community that we have created through articles, through other things, we believe we're getting virtually all the cases reported to us.
But are they getting all the cases? Example. According to the CDC, there are only 27 AIDS cases in all of the state of Texas. But 2020 has learned that in the city of Houston alone, there are an estimated 100 AIDS cases.
I'm an internist in private practice here in Houston who's now seeing at least weekly one patient with AIDS or some depression of their immune system.
When information on AIDS was first published in April of 1981, there were 5 reported cases nationwide and 2 deaths. By that summer, it was recognized as a serious public health problem. There were 108 cases, 43 were dead. In the summer of 1982, there were 593 cases, 243 were dead. The latest figures, there are over 1,400 reported AIDS cases. 541 are dead, and that is just the official body count.
Things are getting worse. There's more patients, more complexity to the situation, more hysteria, and no easy answers.
In March, Dr. Linda Laubenstein sponsored this International AIDS Conference at New York University Medical Center. Since this is ground zero for this frightening medical mystery, The other nations affected are looking to the United States for research leadership. So far, they say, they are disappointed.
I think I'm a bit amazed that not more research has been done, because there are so many cases, there are so many opportunities to study this.
In fairness, the federal government does claim to have spent almost $15 million in the fight against this epidemic. But most critics maintain that up until now, at least, the federal government has not done enough fast enough. Example, it was not until the summer of 1982, after it became clear that AIDS posed a threat to the nation's blood supply, that the National Institutes of Health, the major source of research funding, even issued their request for grant applications on the subject of AIDS. As of today, just 18% of those research requests have been granted.
Phil? Yeah? Can I have my drink? Sure.
Aside from the classic problems associated with catastrophic illness like inability to work and inadequate medical insurance, AIDS victims must also deal with the trauma of being both a patient and a pariah, even in the hospital.
And one night I heard two, I believe they were the nurses' aides, not the actual nurses. I'm standing outside my door, sort of laughing, and I would almost say placing bets on how long is this one going to last.
What did they say exactly?
How long the faggot in 208 is going to last.
There's no question and no denying that there is a feeling among members of any of a number of professions, or just the general population, that patients with AIDS, many of whom are homosexual, are a little bit different. I think that that has probably, at least early on, led to a little bit of a complacency about the approach towards this disease.
Dr. Anthony Fauci is a top government researcher. The attitudes he is talking about almost lost him the chance to work with the very patient who is the focus of his current research.
I was refused at this hospital.
36-year-old Ron Rizio was refused admission to the Clinical Research Center at the National Institutes of Health, despite the fact that he had been receiving treatment here as an outpatient.
I had double pneumonia confirmed by x-rays and a temperature of over 103. I was interviewed, or I should say inquisitioned, by a doctor who kept calling it the gay plague.
The official reason for the refusal was the feeling that his case did not fit into the facility's long-range research plans.
How did you get into this hospital then, finally?
When they found out I had a twin.
The attitude toward Ron changed dramatically when government researchers discovered he had a healthy, identical twin brother, providing them a textbook opportunity to search for a cure. Brother Don flies into Washington for 2 days every 3 weeks from his home in Vicksburg, Mississippi, where he lives with his wife and children. It is Don's healthy white blood cells that are being used to boost Ron's immune system, but it is not easy for either man.
It's very frustrating to come up here every 3 weeks and watch parts of my brother disintegrate. Watch him have trouble with his eyes one time, problem with his lungs, capaces, different things, and you just keep asking yourself, how long can that go on?
Whatever your personal feelings about the homosexual community, the basic complaint of these candlelight demonstrators rings true. Until it was discovered that this disease posed a threat to the nation's blood supply and began claiming other less controversial victims, we all paid a lot less attention than we should have in the beginning.
Do you ever feel like just giving up?
Not very often. I think one of the things that makes me a good patient is that I am a fighter. And I have decided that I'll be the first one to make it, first one to get over this.
We can hope he does. It's a terrible situation. What are the symptoms of AIDS?
There are several symptoms, Hugh. I guess the first most obvious one is swollen glands. Then those bruise-like markings on the skin you saw in the piece itself. Weight loss, persistent fever, night sweats, persistent dry cough, persistent unexplained diarrhea. Those are the most common symptoms.